Alternative Dig Talk. Real issues, real talk.
Hey Teddy, have you noticed how little attention science and health issues get in the media?
Totally, Edgar, yet science information is very important.
Yeah, for sure. That's why the Health Journalists Network is here.
How can they help?
They are a group of journalists dedicated to advancing public understanding of healthcare issues through impactful reporting on health and science.
Oh, really?
Yes, they meet up every month with scientists and researchers, policymakers, and activists at the Science Media Cafes. They then relay what they discuss to the public.
Does that benefit us?
Oh yes, very much so. This helps with health and science literacy for a healthy Ugandan society.
Okay. I love getting informed about science and health issues. Health information makes all the difference between life and death. I'll look them up and engage them.
That's great. They are based all over the country.
Oh, okay. That's interesting, and they should be making real impact.
They are empowering health communities through journalism. Journalists can save lives just like doctors.
The Alternative Dig Talk. Real issues, real talk.
Welcome back to the Health Hub. My name is Esther Nakkazi. I'm a science journalist. I'm also the team leader at the Health Journalists Network in Uganda, which brings together journalists who are very professional and they are based in different media houses in the country. Today at the Health Hub, we are going to discuss HIV prevention. We know that there are many different ways of preventing HIV, and we have talked about the different products that are available. But today we are going to focus on a study that was done here in Uganda and in South Africa. It was an amazing study because when they gave young girls an injection that is used twice a year that has a drug called lenacapavir, they did not catch HIV. So this is a way people can prevent themselves from catching HIV. Today we are going to host Dr. Flavia Matovu-Chiwewa, who is the head of research at the Makerere University, John Hopkins University project based in Kampala in Mulago, and she's the principal investigator of the research that was done in Uganda. She's going to tell us about this wonder drug, which sort of acts like a vaccine, but it's not a vaccine, but it's preventive of HIV. It's called lenacapavir, and she will explain everything to us about how it can be administered, and she will also explain that this lenacapavir does work well in pregnant women. So we have had issues of women who are pregnant and they cannot take certain drugs because they have not been tested in pregnant women. But this particular drug, lenacapavir, can be given to women who are pregnant, and it has not caused any harm among the women who are pregnant and their unborn children. So just to say that the drug is safe for all men, women, children, and especially pregnant women.
My name is Dr. Flavia Matovu-Chiwewa. I'm the Director of Research, Muju Research Collaboration, Upper Mulago Hill Road, and I'm the National Principal Investigator of the Purpose 1 study in Uganda. Purpose 1 is being conducted in 2 countries, Uganda and South Africa. There are 25 sites in South Africa and 3 sites in Uganda. We have a site in Mityana, we have a site in Masaka, and a site in Kalangala. We conducted this study since 2021, and we included over 5,000 women to take part in this study. These were young girls aged 16 to 25 years. And these girls were at substantially higher risk of HIV, looking at their lifestyle. So when the girls enrolled in the study, they were either given the lenacapavir injection, or we have another investigational drug called FTAF or Discovery, and we also had the oral PrEP, the available oral PrEP FTDF. And we have shown that lenacapavir protected these girls from getting HIV 100%, because there is no girl who got HIV infected while in the study. After, because now we have finished the trial phase of knowing whether lenacapavir works, right now every girl who comes back, we are giving them lenacapavir if they so wish. So they are getting lenacapavir, the active. Now they know that they are getting the active product, lenacapavir. So we have had 100% acceptance almost in Uganda. They're all accepting lenacapavir. South Africa is about 90%, and even those 10 who do not accept it, because they are moving on to work abroad and so on. But it has been well accepted, it is safe, it is well tolerated, and the girls are very happy with this method that they get only once in 6 months, 2 injections in a year. Emphasizes that if we use lenacapavir in pregnant women, because a woman who is pregnant is not only at risk on her own, but also they are at risk for the infant, but also for the spouse, but we are mainly focusing on the child. So if you prevented a woman from getting HIV, then you can also prevent the child from getting HIV. We are seeing many infants get infected, and most of these are born to adults and girls and young women. Most of the infections we are seeing in children now are from the young mothers. So if we targeted these very young mothers to receive lenacapavir and protect them from HIV, we are protecting their infants, and therefore we are eliminating mother-to-child transmission of HIV, and should then become accessible anytime in Uganda. We need to prioritize young women and also women who are pregnant, so that we can eliminate mother-to-child transmission of HIV. In the study, we found that lenacapavir was very safe for these pregnant women. We found that it's very safe for the infants, because also the infants were enrolled as participants, and there were no concerns at all. So we are very sure that we have gotten a method that is safe, that can be tolerated, but importantly that is long-acting and can protect our populations who are struggling with using condoms, with using oral PrEP, to be able to protect themselves against HIV. As you know, a woman is vulnerable in any part of the world. A woman is vulnerable regardless of your education status, but more so the girls who are younger and cannot negotiate sex with their husbands or with their partners. So this is a new option that's going to be added to the prevention tool, but importantly for Uganda, we are looking at it as a safe, a life-saving intervention, especially for children who will not be able to get HIV because their mothers are protected. Unfortunately, for the girls who are on FTAF, or the smaller tablet Discovery, there was no difference between the infections we saw in that group and the group that took FTDF, meaning that these 2 products were not adhered to by the girls. They didn't take the products as expected, and therefore the FTAF, that's the tablet, didn't work well to protect them, but the injection worked 100%, and we are glad that for these young girls who are struggling to take pills every day, even those who come and take pills, you find that they don't come back. We are glad that they will be able to get a method that is discreet, that they can use less frequently, only 2 times a year, and it can protect them against HIV. So currently we have a sister study called Purpose 2. The results came out a few days ago, and following this, the sponsor of the studies is going to file for licensure with the Food and Drug Administration in the US, and thereafter we shall have our local authorities, National Drug Authority, they're going to also approve this drug, and then Ministry of Health will be able to put lenacapavir in the guidelines, and thereafter people can be able to access lenacapavir as an HIV prevention tool. It's important to note that we have other options already. We have the oral PrEP, we have the ring, we have cabotegravir 2-monthly injection. So lenacapavir is an addition to the toolbox. People will be free to choose what works for them. Someone may want oral PrEP, another person may want cabotegravir or the ring, or another person may want lenacapavir. But from our experience with contraception, we know that people like the longer acting interventions, especially injections. That's why we have many people on depot. Out of every 10 people who goes to a facility and they ask them what contraception they want, they all opt for depot because it's longer acting, it is discreet, the partner will not know that someone is on depot. The same for this injection. We anticipate that definitely many people are going to opt for the injection because you don't have to use it to take every day, and then it protects you for around 6 months plus. So we are glad that we have an intervention that can fit in the lifestyle of these young adults and girls who are very mobile, very busy, and they're not able to cope with either using condoms because they cannot negotiate condom use and also cannot cope with taking pills daily. So lenacapavir is coming to fill in that gap for those girls who have been struggling on the available prevention interventions. And we are glad that Uganda as a country, we have participated and we have contributed to this. Now the next step is to make sure that people access this product as soon as it is approved by the Food and Drug Administration in the US and also National Drug Authority in Uganda. Yes, so for any injection, usually the side effects are site reactions. So definitely we had to report everything. If someone says they felt pain, which is expected, even if they inject you with...
In addition to what Dr. Flavia Matovu-Chiwewa has said, we also have different experts telling us about the different post-exposure prophylaxis methods that are available in the market, or PrEP. There are different ways to prevent HIV. There are condoms, there are pills, there are injections, and the experts who are based here in Uganda can tell us how these work and how you can best use them. You have a choice on what to use.
Socially speaking, as we've heard from Dr. Flavia, one active lady can actually take on 5 also men in one day. It is not very easy for the reverse to happen. A man cannot easily take on 5 different women sexual on the same day because, not many can, because they tend to lose a lot of energy in the one section count. By the time they're the second, they can't probably go to the third. So you discover that number of partners per day, all per given fixed time, females will have more than males. So that also increases the social risk. But so the question, we had to convince the REC committees. That is easier because they are scientists and the community people. But then there is the ethics in the eyes of the community. That's a different thing. Then there was the issue, why 18 to 24? So to be specific, in some meeting they asked us, meaning that is sex for only girls who are 18 to 24. In fact, in one meeting, a lady asked us, said that I'm 39 years, so you think I should stop being active? Another one said I'm 40-something, but I'm more active than some of those younger people. I also need protection, you know? So there are all these issues.
As the Minister of Health, for us, most of ours is anchored in addressing, as I said, biomedical interventions, making sure that we implement them with the fidelity and implementing them up to scale. So when we get lenacapavir, what are the dynamics it will play? From the experience, as I was hearing, that there is pill fatigue, the current method which is we are using oral, and there are also issues, some research which has been done associating oral pills with the gender-based violence, intimate partner violence, when the partner finds out that someone is taking pills, and all those other dynamics which might not be favorable for someone to take HIV prevention. We hope that when we implement lenacapavir, our sisters, the AGYW, and all the population will be able to access a method which is safe, effective, but also one thing is discreet. So no one will know that you are on a method, so that you start, we hope it will address those issues to do with the gender-based violence and other issues related to oral PrEP, which are leading to non-accessibility to oral PrEP.
We had these meetings and they asked very important questions, by the way. So why us? You mean for us, when the thing finally discover that it works, you mean for us we don't need it? Because I may be the one who is afraid of the person I'm going to have sex with. I need to protect myself. I test I'm negative, but I can't avoid buying sex from this person. And then I need to protect myself. I don't want to use a condom. One person told me, if I choose to pay for sex, then I must enjoy it to the maximum. So the condom is interfering with my pay. Yes, because if I've chosen to pay for it, then I should enjoy it to the maximum. Therefore, putting a condom, it interferes. It reduces the efficiency and the cost effectiveness of the pay. Therefore, how do you get protected? So those issues, they kind of are ethical, but also they are moral, ethical, but also they are kind of community engagement. But particularly, as I conclude, with regard to the ethics of the trial, that was mainly handled at the research committees, and that was a part that was coordinated by the National Coordinating Center at the Muju.
But if you can, please, abstinence is over 100% protective. Yes, it is more than lead, because you are not exposed at all. Then being faithful to your partner who is HIV what? Negative. Condoms, they have worked time immemorial when they are properly used. Then we have circumcision for men who are here. It still works for you. Then on top of that, we have ARVs for what? For prevention. We still have the oral. We have the ring, and currently, under the program, we are having cabetographer. My appeal is that as we roll out these measures, please get what works for you. As we wait for Len, let Len come when you are HIV what? Negative. So get what works for you currently in the bar that we have. Yes. We, as I said, as one of our strategy is adopting new, safe and efficacious strategies that work to prevent HIV.
We also have testimonies of different people who have used some of these products that are on the market. Some of people who have used them are couples that are discordant, meaning either the woman or the man might have HIV, or the woman doesn't have HIV. That represents a discordant couple, or a man who has HIV and a woman doesn't. So these are married, and they can stay married, and they can use or choose to have one of the products that have been explained by the experts, and they will not catch HIV. And these products are available on the market. It is just a matter of you making a choice on what you want to use, and you will not catch HIV. So let's listen to these testimonies of people who have used these products and how they have worked for them and how they have helped them keep safe in their marriages and happily married.
Mukyala mufumbo myaka 28 nali nina emyaka 22 then nenkizuula ng'omwami wange alina obulwadde ng'ate nze sirina then ne tuba ne struggle y'amaanyi mulamu nze ndi mulwadde ne mpulira ng'obulamu bukome. Jjukira ndi mukyala wa mpeta, tolina nsonga gy'oyinza kuwa abantu, olina okuwa reason. Baga omukyala amaze emyaka egyo gyonna atuwa reason nti yanobye, nti yakoze eki. Kati then ne ntuwa wansi ne ngamba nkoze ntya ng'amagezi ganneesibye, omwami wange tayagala kondomu, kwegamba ne mbeerawo nga binsobedde ne ngamba bannaye nkomye, nga mpulira nkomye. Kati ye solution gye yampa yaŋŋamba kimufunayo omusajja omulamu ogendengayo nga bw'okomawo wano. Nendaba ate ngamba nyenze nga ngambye ŋŋendengayo nkomewo, bwe nvaayo ewoli omusajja omulamu nga nkomawo. Nendaba ng'ate era mba nyenze. Kati then nga reason tekutuse. Kati waliwo omukwano gwange n'aŋŋamba naye gendako emulago waliyo ekibiina ekikola ku bakyala ng'omwami mulwadde omukyala mulamu nenzija emulago nennoonya ne wambula nenzirayo naŋŋamba ddayo natambula mulago nentambula mulago paka mukama bwe yannyamba ne baŋŋamba yambuka eri waggulu gye bali ne mbasanga then ne bankolako kati myaka 5 nga nze mmira n'omwami bw'ali naye abantu tebakikkiriza era abakyala mbawanyo advice eyo ne bagamba mugende mwekebeze wadde omwami obeera le kubanga ze nalinga neekebeza nga yaŋŋamba tuli balamu olaba weekebeza gwe tuli balamu nga ye byalumiriza nga tetumanyi kati abakyala mbawa advice eyo ewaffe mbagamba nnyo bagende beekebeza abafumbo bw'osobola okwekebeza omu kubanga era omusajja eyatukebera yaŋŋamba nti ono omusajja mubadde mugenda bugenzi awutu naye ne mugamba nedda bba wange tumaze emyaka bwegi naŋŋamba ekiki musajja yeewuunya nnyo ne mugamba na musajja kati ate bwe twagenda okwekebeza ye yaŋŋamba dokita mbu dokita namuwaddeyo ssente agambe nti ye mulwadde then ne tugenda ne batukebera wala wonna nga buli batukebera bagamba mulwadde nze ndi mulamu naye amakerenda gannyambye nnyo amaka gaakomawo kati bwe namugamba bampadde amakerenda yasanyuka n'agamba waaw nawulira essanyu nga limutta kati gampaniridde nnyo bannange era neebaza simanyi nange ki gye ngenza beebaza abagaleeta simanyi ngeri ki naye ng'abakyala mbatuuze yewaffe ne mbasomesa ne bagamba bannange bw'oba olina bbawo nga mwezi dduka misinde otere weeziyize nga tonnabafuna buzibu dduka weeziyize gwe era nze mbasomesa ne bagamba mugende ne mbasindika emulago yes omusajja ayinza okuba omukwata n'oli ate okufuna obulwadde nze yeeziyizza mba nsinga okusinga okubufuna
badde maze ebbanga lingi nga ndi ku prep naye nentuka ekiseera nembivaako emabegako awo oba tolina ssente bulungi tosobola kumalako na prep eddagala ly'amaanyi nga wakasooka naye oba oluddewo ebikutawaanya kati wogatako n'emirimu gy'okola bikumalamu nnyo amaanyi naye oba oluddewo ng'obimira mu budde omira buli lunaku tekirina buzibira tebikuyisa bubi naye nze natuka ekiseera nembivaako nga nkyalina ebinkolaki ebintawaanya naye nali mbikozesa bbanga ddene nnyo nga sirina buzibu wadde naye nembivaako tenyinza okwogera ku bawala bato okwekuuma bulungi nakugenda ku mapi okugenda ku mapi batandike okufunayo obuyambi bakozese prep olwokuba prep eyamba bintu bingi nga bakuwa kaadi ng'ofuuka mmemba waayo nga bakubuuza gy'obeera n'enamba ya ssimu era obuyambi bwonna bwe bagaba oba olina omwana oba olina omusajja wo gw'omanyi ati si ono wa kiyaaye oba nga oba oli mulwadde gwe n'omusajja wo bakujjanjaba oba omwana wo mulwadde naye bamuwa obuyambi.
Thank you so much for listening to this show, The Health Hub. We are looking forward to having you next time. I've been your host, Esther Nakkazi, a science journalist. I'm also the team leader at the Health Journalists Network, which is made up of journalists based in different media houses. They mostly cover health and science, and they are very professional, and they are based all over the country. Bye, and see you next time.
Hey Teddy, have you noticed how little attention science and health issues get in the media?
Totally, Edgar, yet science information is very important.
Yeah, for sure. That's why the Health Journalists Network is here.
How can they help?
They are a group of journalists dedicated to advancing public understanding of healthcare issues through impactful reporting on health and science.
Oh, really?
Yes, they meet up every month with scientists and researchers, policymakers, and activists at the science media cafes. They then relay what they discuss to the public.
Does that benefit us?
Oh yes, very much so. This helps with health and science literacy for a healthy Ugandan society.
Okay. I love getting informed about science and health issues. Health information makes all the difference between life and death. I'll look them up and engage them.
That's great. They are best all over the country.
Oh, okay. That's interesting, and they should be making real impact.
They are empowering health communities through journalism. Journalists can save lives just like doctors.
The Alternative Dig Talk. Real issues, real talk.